both sides, Democrats and Republicans, are calling check here. But regardless of who wins the game of chess, how do Americans and the American healthcare system fare? Our first guest this afternoon, in what will be a jam-packed one, Congressman Mike Pence, chairman of the Republican Conference. Pence spoke earlier this week at a Kill the Bill rally here in Washington and at a Tea Party rally in his home state of Indiana. Congressman, welcome back to the program. I'm grateful for the
Thanks,
time.
Dylan.
Your response to the CBO scores?
Well, only in Washington, D.C. Can people announce they're spending $1 trillion and they're going to reduce the deficit? I mean, this it's just pretty amazing, Dylan. The president calling this the greatest deficit reduction since the Balanced Budget Act. I mean, we're launching a massive $1 trillion government program. They have a rough estimate from the CBO that says in the first 10 years, using the models they're using, that it's going to cost $100 billion less than the tax increases and the Medicare cuts they're going to use to spend it. But this is growing government. The American people know it's going to increase deficits, going to increase debt. You know, I took a look just before I came on. Medicare actually cost by 1990 7 times what CBO said it was going to cost when it was enacted into law. The unbroken history of entitlements, the American people know it, is they cost many, many multiples of what the official estimates are. Yeah. And this massive government plan, with the CBO score notwithstanding, isn't fooling anybody.
Now, you and I both know that you look at any poll, you have any conversation, half the room will say, yes, we want this. Half the room will say, no, we don't want this. Almost all of the room will say, listen, I don't trust the Democrats. Are doing a bunch of backroom deals. It's a mandate into an unreformed monopoly, and I don't trust the Republicans because all they've tried to do is kill the bill and have ultimately not offered a better competing proposal. How can we go from two parties trying to take each other down to two parties trying to solve the issue of that we spend 20% of our GDP or 17% of our GDP in 2009 on health care, and everybody would like to see politicians competing to deal with the underlying problem as opposed to trying to take each other out?
Well, number one, the only bipartisanship in the House of Representatives today is the bipartisan opposition to this bill. I mean, the reality is that we have this forming coalition of members, whether it be on the Democrats that oppose public funding of abortion, which is in the Senate bill, whether it be Democrats who are concerned about launching $1 trillion government program with hundreds of billions of dollars of taxes and mandates. I mean, there's an interesting coalition growing. I think if we can stop this bill, if it comes to the floor this weekend, stop this bill, we're going to have an opportunity to immediately go to work on the kind of incremental step-by-step reforms that Republicans have been offering, that we detailed at the Blair House meeting, we detailed to the president at our retreat. You know, our proposals, we've talked about, Dylan, to let people buy insurance across state lines, pass malpractice reform, deal with pre-existing conditions. The only other thing I'd say is, you know, I did 5 town hall meetings in Indiana. I did it in a lot of cities where the majority of my constituents are Democrats. And I'm going to tell you, Dylan, it wasn't half the rooms here, half the rooms there. The people back in eastern Indiana are overwhelmingly opposed to this government takeover of health care. They want Congress to scrap the bill, start over on what I just described.
I understand and I agree with a lot of what you just said. I dispute a couple of points. One, every poll I see basically has half the room with it and against it. I'm referring to the NBC News Wall Street Journal poll, which is 46-45. You've seen those polls. But more importantly, I take a little bit of issue with your characterization of this as a government takeover, and I'll tell you why. When I look at private industry, when I look at the unreformed insurance monopoly, and I'd like to draw your attention, if I could, to the S&P 500 Managed Healthcare Index, which is an index of the private health insurers. This mandate has caused explosive movement in private insurance company stocks. They are up 70% over the past year, and they are up 35% since any talk of either a real exchange with competition, movement across state lines, anything that your colleague Paul Ryan would talk about, or anything that some of your opponents might talk about on the public option, any real reform. As soon as that was off the table, private industry exploded higher on the news that the government was not going to take over health care, but that it was going to mandate that people push money into private industry, which in some ways is equally offensive, if not more so.
Well, look, on the poll thing, I think in the same poll it showed 48% of Americans thought Obamacare was a good idea, and about 35% said it was a bad idea. I think it's... Look, I'm not going to debate polls with you.
Exactly.
I'm just telling you what I saw in the state of Indiana. People are overwhelmingly opposed to this. Now, whether it's a government takeover of health care, well, oh, wow, here's a shock. If the government is poised to mandate that every American purchase health insurance, whether they want it or need it or not, that health insurance stocks are going up. Gosh, I think you're onto it, Dylan. I mean, look, let America, there's like 1,200 insurance companies in this country now. Let Americans enter the marketplace on a nationwide basis the way big corporations can and purchase health insurance wherever they think is the best fit for their family or their small business or their family farm. But, you know, and that's not a Republican idea per se. I mean, Ron Wyden, a liberal Democrat in the Senate, and I have talked about his bill, does the same thing. But what we have here is a government takeover of health care, because in addition to mandating every American buy it, they're going to create these massive exchanges and require what insurance companies offer. They're going to mandate what businesses cover, and they're going to pay for all of that with hundreds of billions of dollars of tax increases. This isn't being lost on any of my constituents back in Indiana, that this is a massive government takeover of health care, and I think that's why the American people are opposed to it.
I got to wrap this up, but can you tell me now that in the event that this bill does, for any reason, fail, that we would very quickly see the resurrection of this debate so that you could move into real reform?
Yeah, because you know, your chess analogy was very, very interesting. But look, this isn't about shirts and skins and winning and losing. And for heaven's sakes, it's not about the president or the presidency or something. This is about the American people. We've got to do something to lower the cost of health insurance for small business owners and family farmers. The day after we bring this bill down on the floor, I guarantee you, Dylan, I'm going to sit down with the Democrats that helped us stop it, and we're going to work in good faith to advance the kind of incremental reforms that'll bring real relief to working families. That's malpractice reform, purchase across state lines, use the savings to cover pre-existing conditions. That's my promise to you and your viewers. We'll go to work the day after we stop this Obamacare bill.
Listen, Congressman, a pleasure to get some of your time. Thank you for it. We'll talk to you soon, I'm sure. I want to get back to thank you.